Picture this. It's 3 a.m. and you're lying in bed, wide awake. Your feet feel like they're on fire. Or maybe it's your hands, prickling with 1,000 tiny invisible needles. You shift, stretch, and pull the covers away, searching for relief. But nothing seems to help. You've mentioned it to your doctor before, and while their words were gentle, they left you unsettled. "It's just age," they said, with a polite smile, but deep down, you knew there was more going on. What if the problem isn't age at all? What if there's a real treatable cause hiding in plain sight, something that could be addressed if only it were understood? The truth is, your body has been sending quiet signals for months, maybe years, and now it's time to listen. The hidden wiring. Inside your body, there are roughly 45 miles of nerves. That's enough wiring to stretch from New York City to Philadelphia. These nerves are your personal communication network, transmitting sensations from the tips of your fingers and toes to your brain, allowing you to feel everything: the warmth of a hug, the softness of a loved one's touch, the pressure of your feet on the ground as you walk. Every nerve is wrapped in a protective sheath called myelin, much like the insulation around electrical wiring. Myelin keeps the signals precise and intact. When that protective layer starts to deteriorate, the signals misfire, causing sensations that can range from tingling and numbness to burning or stabbing pain. Over time, this can develop into a condition called peripheral neuropathy, which affects millions of people in the United States. For many, it's a confusing, isolating, and frustrating experience. But the encouraging part is that it doesn't have to be permanent. The real cause. What most people don't realize is that nerve problems are often linked to vitamin B12 deficiency. While it might seem surprising, this nutrient is crucial for the proper functioning of the nervous system. Unfortunately, modern lifestyle factors, medications, and even aging can make it difficult for your body to get enough B12. Medications that millions take daily, such as metformin for blood sugar control or proton pump inhibitors for heartburn, can unintentionally interfere with your body's ability to absorb this life-essential vitamin. When these common factors combine with a plant-based diet or natural reductions in stomach acid due to age, your body can struggle to get what it needs, leaving nerves vulnerable to damage. Why B12 matters. Vitamin B12, also called cobalamin, is critical because it supports two major systems that keep your nerves healthy. First, it participates in methylation, a chemical process that converts homocysteine, a potentially harmful amino acid, into methionine, which the body uses to produce S-adenosylmethionine, GASME. Same is essential for the repair and maintenance of myelin, the insulating layer around nerves. Without B12, this process falters, leaving nerves exposed to injury and degeneration. Second, B12 is vital for the production of energy inside every nerve cell. Each nerve cell contains tiny powerhouses called mitochondria, which generate the energy necessary for proper function. If B12 levels are too low, mitochondria struggle, energy production drops, and toxic byproducts can accumulate, further damaging the nerves. In other words, B12 deficiency attacks nerves on two fronts. It prevents repair and simultaneously weakens the cells from within. Early warnings. The early symptoms of B12 deficiency are subtle but important. Tingling, numbness, burning sensations, or a feeling of pins and needles are your body's way of signaling distress. These sensations aren't minor annoyances. They are early indicators that your nervous system needs attention. Many people ignore these signals, assuming they are just part of aging or unrelated to diet and lifestyle. but recognizing them early is crucial. Acting promptly can prevent permanent damage and help restore function. Understanding the science. The story of vitamin B12 begins nearly a century ago. In the 1920s, doctors were confronted with a mysterious and fatal condition called pernicious anemia. Patients became severely weak, pale, and experienced neurological complications. Traditional treatments failed, and death seemed inevitable. Then researchers discovered that feeding patients raw liver dramatically improved their health. The result was so remarkable that these researchers won the Nobel Prize in Medicine in 1934. Years later, scientists identified the key molecule in liver responsible for this transformation: vitamin B12, a complex compound with a cobalt atom at its core. Another Nobel Prize was awarded for decoding its structure. These discoveries highlighted how essential B12 is for human survival, particularly for nerve health. How modern life creates deficiency. Today, B12 deficiency can occur even with seemingly healthy habits. Aging naturally reduces stomach acid production, making it harder to extract B12 from food. Plant-based diets, which provide little to no B12, further increase risk, and common medications, such as metformin or acid-blocking drugs, create what could be described as a perfect storm for deficiency. Over time, your body may show signs of stress long before a standard blood test registers a problem, which is why functional testing is critical. Tests for methylmalonic acid, MMA, and homocysteine levels reveal whether your cells are actually getting enough B12, rather than just measuring the amount floating in your bloodstream. This distinction can be life-changing. Choosing the right form. B12 supplements are not all created equal. Many over-the-counter options contain cyanocobalamin, a synthetic form that your body must convert to active forms before it can be used. For some individuals, especially those with genetic variations, this conversion is inefficient, meaning the supplement may provide little benefit. Instead, look for methylcobalamin and adenosylcobalamin, the bioactive forms that your nervous system can use directly. Hydroxycobalamin is another excellent option. These forms support both myelin repair and cellular energy production, addressing the core mechanisms behind nerve health. Delivery matters. Absorption is another critical consideration. If your digestive system is compromised due to age, medication, or other health conditions, oral pills may not be effective. Sublingual tablets or liquid drops, which dissolve under the tongue, bypass the digestive tract and enter the bloodstream directly. For more severe deficiencies or active nerve damage, intramuscular injections provide the most effective delivery, ensuring that B12 reaches the cells that need it most. Many patients notice significant improvements within weeks when receiving injections, alongside a tailored supplementation plan. Therapeutic dosing. Correct dosing is essential. For maintenance, lower doses of B12 may be sufficient, but when addressing active nerve damage, higher therapeutic doses are required. Daily intake of 1,000 to 5,000 micrograms of methylcobalamin over several months is often recommended for significant improvements in nerve function. Research shows that these doses can reduce pain, improve nerve conduction, and enhance quality of life for those suffering from peripheral neuropathy. Supporting nutrients. B12 doesn't work in isolation. Other nutrients play a critical role in nerve health. Vitamin B6, in its active form, P5P, supports the same pathways as B12folate, as methylfolate is essential for methylation and myelin repair. Vitamin B1, especially in a specialized form called benfotiamine, protects nerves from damage related to high blood sugar. Magnesium helps regulate nerve signaling, reducing false pain signals. Alpha-lipoic acid, a potent antioxidant, protects nerve cells from oxidative stress and supports overall nerve function. Together, these nutrients create an environment in which the nervous system can thrive and repair itself effectively. Food foundations. While supplements are vital for correcting deficiencies, food provides the long-term foundation for nerve health. The richest sources of B12 are animal-based, organ meats like liver, shellfish such as clams and mussels, fatty fish including salmon and sardines, grass-fed beef, pasture-raised eggs, and quality dairy products. For those following a plant-based diet, supplementation is not optional. It is essential. Natural bioanalogues found in certain algae or spirulina are ineffective and can even interfere with absorption and testing. Prioritizing both food and supplementation ensures that your body receives a steady supply of this crucial nutrient. Taking action before it's too late. Nerve damage is often irreversible once it progresses beyond a certain point. That burning, tingling, or numbness is your body's urgent signal that action is required. Addressing B12 deficiency early can prevent permanent loss of sensation, mobility issues, or falls that may result from impaired nerve function. The good news is that, unlike many chronic conditions, B12 deficiency is entirely preventable, identifiable, and treatable. With the right approach, your nervous system has an incredible capacity to heal and restore itself. Success stories. I've seen patients regain mobility, independence, and comfort after years of living with nerve pain. People who could barely walk across a room have regained full function. Individuals who struggled to sleep due to persistent, burning sensations have finally found relief. The common thread among these successes is timely action, early identification, correct supplementation, and a focus on supporting nutrients create conditions that allow the nervous system to repair and recover. Moving forward, if you recognize yourself in this discussion, it's time to take proactive steps. Start with proper testing, including functional markers like MMA and homocysteine to assess your cellular B12 status. Choose high-quality, bioactive forms of B12 and consider sublingual or injectable delivery if absorption is a concern. Incorporate supporting nutrients and ensure your diet provides a foundation for long-term nerve health. The sooner you address these issues, the greater the likelihood of reversing early damage and restoring function. Hope and healing. The story of vitamin B12 is one of both caution and hope. While deficiencies are common and can quietly undermine your nervous system over time, the solution is remarkably accessible. By understanding the underlying mechanisms, acting on early warning signs, and supporting your body with the right nutrients and lifestyle adjustments, you can protect your nerves and reclaim comfort, mobility, and quality of life. Final thoughts. Your nervous system is resilient, and with proper care, it can recover from years of strain and deficiency. The signals your body sends, tingling, numbness, burning, are not just symptoms. They are an invitation to act. By addressing vitamin B12 deficiency and supporting your nervous system with the right nutrients, you can prevent permanent damage and experience a level of relief and vitality that may have seemed impossible. Healing is not only possible, it is within reach, starting today, with knowledge, diligence, and care.